Welcome to our immune course on posture. Very, very important we understand about posture, because bad posture is a primary cause of disease, and we need to be able to understand it to cure it.
The ideal posture is one that creates minimal stress and strain on body structures and allows for maximum efficiency of the body.
We start the Nelson method by trying to reduce the causes of disease and learning about the causes of disease. And very, very important, look, bad posture is one of the primary causes of disease. And we can see that it affects us in so many different ways, creating so much different problems. Bad posture is a primary cause of disease, and we must be able to correct it. Here's a nice little start with the wall angel test of posture. Let's learn about how to use it.
You're going to start leaning against the wall, and your feet are about a foot or so off the wall. From there, you're going to try to assume the position of a wall angel. So you're going to be about 90 degrees at your elbows here, and you're going to try to assume a flat position.
So as we see from this diagram, this little picture, the wall angel test of posture, that we want to be able to make contact with the wall, and we're going to learn more.
But the first things you should look at is your position. So we want to think about our rib cage here. Make sure that touches the wall. Your low back can be off a little bit. If you feel that off, that's fine. But we're really looking at this region here. Your rib cage is touching the wall. Your shoulders are touching the wall, and your head's touching the wall.
We're going to learn with our feet about 5 inches from the base, from the wall, just how much we need to contact. And a little bit there from the low back that is allowed. But basically, all the different contact points we need to learn to do this test.
You basically want everything in contact with the wall. You want your head in contact with the wall, you want your rib cage in contact with the wall, and you want your pelvis in contact. The things you're going to look out for would be if your rib cage, especially here, were way off the wall. If you could slide in a big hand in there, that's not good.
Too much slouch in the upper back can produce the kyphotic curve, kyphosis, and that could be a problem. And too much in the bottom can be the lordotic curve, too much lumbar twist.
So again, ideally our arms are flat against the wall, our head's in a good, nice neutral position, and ideally we can get our wrists to touch the wall with our fingers. Very difficult for most people to do, but that's the goal, is to achieve success on this. And
This wall angel test can also be done to help be an exercise, to help to correct. By moving the arms up and down, we could then help to correct the posture.
The head position is crucial on a lot of people. You'll see people that lack mobility actually extend backwards. So, yep, just like Leon's doing there, you'll see that he gets an extended position because he really doesn't have the mobility. Well, that's due to your suboccipitals, which are the muscles on the back of your head there being too tight.
So many of us pull our head forward to look at the computer, to eat, to look at the telephone. We need to recognize we don't want that head pulled forward. The head should be square on the shoulders, up and down.
Perhaps it's your SCM on the front from sitting, postures and that sort of thing. So if you can't get back to the position with your head against the wall without extending, then you know you have areas to work at in your neck.
And you can do this at home and start to check your posture and also start to develop exercises to be able to understand. And you can even do it in the wall squat, snow angels. So that also can help. Posture doesn't just affect health. It's how you feel, communicate, and appear, how you appear to others. Bad posture affects the nerves.
The nerves can then be pinched, crushing the nerve ending, and this disturbs the flow of energy, neural energy, prana, life, chi. Pressure on your organs will increase when you're...
In this video, we will talk about a few muscles that are involved in maintaining ideal posture. As we discuss these muscle groups, remember that there must be opposition in all things.
Each muscle must have a balanced antagonist that works against it.
Posture is mostly about balance, that we have the right type of muscles in the front, in the back, to the left, to the right. We have to be able to get good posture and recognize balance and be able to understand just the difference, good posture and bad posture. how it affects health, how we feel, communicate, and how we appear. So it's very important about balance.
Overuse or weakness in one muscle or muscle group can cause faulty posture.
Faulty posture can result in chronic muscle strains and spasms, disc derangements, bony spurs, and stenosis.
In our courses, we have the posture check examination form. You should learn how to do this when you take the full course on posture and learn more about how to access and correct postural problems.
These are the main faulty postures that we'll be discussing in this video. They include head extension, thoracic spine kyphosis, lumbar spine lordosis, and anterior pelvic tilt.
Desiree Duvernay here. Just turned 71, trying to take care. And we have to recognize as we get older, we have to take care of the spine. Your age has a lot to do with how flexible and how extended your spine is. Our first important bad posture, head extension.
Here's a picture of proper alignment of the head on the neck when viewed from the side.
A common faulty posture associated with this region is excessive extension of the head on the neck.
As your head moves forward, it starts to create more and more of a weight on the body. You can see how it takes more muscles and presses on the bones and the organs a lot more. So posture is very, very, very important.
The suboccipital muscle group is what is responsible for this action. Prolonged maintenance of this posture can result in the shortening of these muscles and chronic strain.
Learning how to bring the food to you and how to bring your phone to you, and recognize how not to load the spine, but to bring the phone to your eyes so that then you can reduce the burden.
To counteract this, one must either stretch the suboccipital muscles or strengthen the antagonistic muscles such as the longus capitis muscle not discussed in lab.
There, I had them repeat it 10 times. So you slouch all the way down again, and then poke your neck forward. There we go, the usual computer typing position. Then I have them draw their body all the way back, really overcorrect, and then from here draw their chin back, and then back off 10%.
Next, thoracic spine kyphosis, caused by slouching.
Chronic slouching can lead to kyphosis of the thoracic spine and scapular protraction.
Too much bench presses, that can also produce that kyphosis, so watch out.
Okay, so what we have to do is we're trying to work on the vertebrae T12 to T6 to help all of the digestion for hiatal hernia, gastroesophageal reflux, etc. So we're trying to work. While we're doing this, we want to use this as an opportunity to do our breath exercises, full lung expansion. Abdominal, chest, all the way up into the head. Can I see how it looks?
To counteract this, one should stretch the pectoralis major muscle and strengthen its antagonist, the middle trapezius.
This will help 15 minutes a day. Lie on your stomach, put your palms to your hips, put your legs together, breathing out, lift your head, chest, upper abdomen, position of your arms. When breathing in, then return to the starting position. Do this exercise 10 times, 3 times a week.
Yes, IMUNE presents why you need to take care of your posture. This is very, very important. When you slouch, you see, you create different problems. Impingement of the nerves, lack of circulation. Posture is very, very important.
Prolonged sitting can result in tightness and shortening of the hip flexors, such as the iliopsoas.
Slouching in the low back can produce the lordotic curve. This needs to be addressed because this can create problems for the digestion, for the lower limbs, and for the entire health.
The muscles that are antagonistic to the hip flexors extend the hip and include the gluteus maximus.
This position will help fight that lordic curve. Feel the tension. Put your feet up on the wall. Lift the tailbone and help to fix those problems.
To counteract lumbar spine lordosis, strengthen the abdominal muscles, stretch the lumbar spine extensors, and stretch the hip flexors.
We can have posterior pelvic tilt or we can have anterior pelvic tilt. It can produce a problem. We have to be able to get some core exercises to maintain the proper, good posture.
A tight rectus femoris can result in anterior pelvic tilt due to its origin on the anterior inferior iliac spine.
Weak abdominal muscles and tight back extensors such as quadratus lumborum and the erector spinae can also contribute to increased lumbar spine lordosis.
So let's look at another postural view of Melina. We're looking now at the lateral position, and the lateral shot, if you remember, gives us in particular our spinal curves and the orientation of the pelvis. So looking through here from the feet, working our way up, because we always go from base to apex. So looking through from the feet there, I've got a dot on the bottom part of the fibula there, the lateral malleolus, and my postural line should go from lateral malleolus, just posterior to the knee joint, through the middle of the greater trochanter, and as I work all the way up through lumbar spine, lumbar vertebral bodies, acromion process, and the mastoid process at the back of the ear, all being level with each other. So if we have a look at those postural dots there, the first thing that you'll notice is, as we come up through that leg line, we notice that, in particular, we have an exaggerated curve here in the lumbar spine. Our thoracic curve slightly exaggerates to compensate for it, and the head is slightly forward, in that this postural dot is forward of that postural dot. So Melina's got a slightly forward-headed posture and an exaggerated lordosis. Now, if we look at the pelvis itself, what I've done here, I'll just get you to fold your arms there, Melina. What you'll notice here is, with these two dots, this dot's marking roughly the line of the PSIS. This dot here is on the ASIS, and what you'll notice is the ASIS dot is quite a lot lower than the PSIS dot. This is an anterior pelvic tilt. The pelvis is tilted forwards, an anterior pelvic tilt.
To teach people the proper position, what we have them do is slouch forward, okay, slouch forward, and then come back into that position, go all the way back far as they can, and then go about 10% forward. So here I am doing some exercises to help the lumbar, being able to help to stretch the muscles, make sure that they don't get too much pressure on the lumbar, and then being able to work the stomach muscles and being able to maneuver. It's very helpful for the low back. That will help for different prostate problems, digestive problems, and a host of other things. And also get a little bit of motion and movement in to help fight the sitting disease. Sitting too much can create a problem. This is a very good set of exercises that can help to restore blood flow and help to balance the low back spine. And let's not forget the posture of the hand. We want to try to fight that metacarpal tunnel, so we have to recognize keeping the hand in the correct procedure. That's going to be very helpful. Posture in the hand position with the mouse.
We're also talking about being in shape, getting oxygen to flow. At old age, it leads to a hunchback. To make sure this doesn't happen, straighten your spinal and abdominal muscles. Don't just sit too much. Every 20 minutes or so, get up. But when you do, sit up straight.
We need to learn to combat sitting disease. movements, exercises. We got to learn about this. This is a big problem, and it should scare you because people are not getting enough motion.
Sitting is the new smoking. Medical professionals worldwide have termed sitting as the new smoking due to the ill health effects associated with prolonged sitting and sedentary posture. We are designed to be athletes, to run fast and to move with agility.
We find out that sitting too much, in fact, most everybody does, sitting too much. And we say that it's the new smoking because it's killing people. Literally, it's having derogatory effects. We must do something.
We are designed to navigate the world with upright posture on our 2 feet, and yet so many of us are hunched over our devices for hours on end every single day. Prolonged sitting is associated with neck and back pain, depression, weight gain, obesity, and even chronic diseases, such as heart disease and cancer.
Our society's put this on as more and more of the jobs are slipping to computer jobs. We have to be able to do something about this. Now here's a bunch of exercises. Being able to just get away from the chair and do a couple of these exercises. Very big to be able to just stretch the spine. You got to get up every 20 minutes and do something else. A little exercise like this can help.
Even scarier than these side effects is the fact that prolonged sitting is associated with early mortality. Just as each cigarette takes years off your life, so does sitting in your chair. Sitting is the new smoking, and yet our chairs don't come with a label like the cigarette boxes do.
Yes, sitting kills. Moving heals. We have to get up. Learn that every 20 minutes or so, get up and do some motion. Do some exercises. Do some stretching.
And then don't forget to stretch
even
the
just
spine
walk, like
for
being
this
able
type
to
of
stand up,
exercise.
hang, do these type of
Stretch
exercises.
the back.
Very,
Best
very
you can.
important.
If you can't do these
Help you stretch
exercises
the back.
completely as she does, do what you can.
Unfortunately, sitting is so bad for the body that even an hour-long workout per day is not enough to offset the ill health effects of prolonged sitting. Meaning, if you work out for an hour in the morning, then sit the rest of the day, you are still at risk for pain, poor posture, and even chronic disease.
With more extension. Be sure to work the neck and the spine.
Sitting is the new smoking, and yet standing alone is not the answer. Standing in moderation is good. However, standing for 16 hours per day is not the solution to reverse sitting disease. The solution to offset the ill health effects associated with prolonged sitting is frequent changes in your posture.
Variety is the spice of life, and we have to learn some of the different ways to help our posture. Wear a rucksack. Wear something in the middle, not on the side. Don't do that. When driving, don't slouch forward. Keep the spine straight.
To change your posture frequently throughout the day, consider the value of a sit and stand capable workspace. This allows you to stand up and sit down while working. Frequently changing position is very beneficial for your body.
If there's heavy
Heavy
objects,
objects,
learn to lift them,
not
not with the back,
no
but
back, but
with the
legs.
legs. Being able to then utilize
Very
and
important.
keep the spine good.
At the
With
computer,
the computer, recognize every 20
sure
minutes,
to
get up and
work
move.
different procedures and learn to keep your stuff.
Another important strategy is active sitting. Sitting on an unstable surface such as your posture cushion or an exercise ball will help you be more active throughout the day. Maintaining good upright posture is also important to prevent pain and fatigue throughout the day.
You have to learn good posture. You have to be able to get that spine straight forward. Don't move the head towards the work, move the work towards your head. Be able to get that and learn good posture.
If sitting is the new smoking, then good posture with active sitting and standing is the solution. Change your posture throughout the day to reap the health benefits of an active workspace, not a lazy workplace that promotes fatigue and low productivity. Your health depends on it.
And as the day goes by, don't
Putting an
slouch
awful lot
too
of
much.
Stress.
Don't keep that posture
Try not
for
to
more
slouch.
than a couple of minutes. Straighten up.
Straight.
Take care of your spine. Learn to move your foot up rather than your back down. Recognize keeping the spine straight, keeping balance, not one side or the other.
To counteract this, one can stretch the rectus femoris or strengthen its antagonist, the hamstring muscle group. In order to correct faulty posture, remember 2 Nephi chapter 2 verse 27. For it must needs be that there is opposition in all things.
Computer.
And when you're typing,
You'll
despite
avoid
that
the
metacarpal
and
tunnel,
other problems.
make sure you
Recognize
keep the
some
wrist
flexibility. We'll say
correctly
correct and
placed.
correct. Also,
That will
very,
help
very
you
important to take a break
learn
every 20
good,
minutes
proper
or so. Get
wrist
up,
posture.
go to a different position, walk around.
As we get older, gravity becomes our enemy. So we have to be able to work against gravity. This is one of the best exercises, hanging. Just see how long you can hang. So we have to be able to keep the spine supple in all the different directions. This is a very, very good exercise. You must do every day. As far as you can. Get the spine.
Do it slower.
Look with the neck. Make sure you get the neck. Work as far as you can. And if you can, get some weights. Maybe even just a couple of books. Okay? Maybe some squirt bottles. Just a little something. This will help you to extend the twist. To be able to help you to extend the twist. Try to do 100 of these every day. Maybe 50 in the morning, 50 at night. But try to stretch that back try to stretch that back as much as you can. While you got the weights, fight against muscle wasting. Doesn't have to do too much. Fight against muscle wasting. Keep those muscles moving. Yoga exercise. Just a simple one. Yoga exercise, just a simple one. Put my leg like this and be able to twist. 20 seconds or more. Get the full twist of the spine. Apologize for the lighting. Get a full twist of the spine. Make sure that you understand the quality of your spine, the flexibility of your spine goes a long way to determining what your age truly is. Okay, what else should I do? Let's just do this again.
Wait, that will be another video then.